Good morning, good afternoon, good evening, wherever you are. Can you hear me?
Yes.
Yes, perfect.
Thank you.
Yes.
Thank you, Gabriel. So we are going to start this session soon. I can see that people are still logging in, so let us just give them 1 or 2 minutes more, and then we'll get started. Okay, we're already 2 minutes past our scheduled time, so I think we should get started. There might be few colleagues who might be joining in as we go through, but we'll go through a quick round of introduction about the event and how we are going to do that. And then we will be inviting our 4 distinguished speakers. I believe all 4 speakers are already logged in. So I would like to start with some information about the event, what we are trying to achieve, what's the purpose of this event, and then I'll hand over this to Sabina. Sabina Sigdal is the event coordinator or coordinator for this Knowledge Cafe webinars, and she'll be moderating the session. So uh, just before entering into the event itself, so One Health Knowledge Cafe is an initiative of collaborators from different countries. So we have 11 collaborators who work together to design this one, and we submitted this concept to Center for International Health at Ludwig Maximilian University, and this whole project is supported by DAD to the exit program, and the program is eventually funded with financial support from BMZ, so Ministry of Economic Affairs and Development of Germany. Let me as I said earlier, One Health Knowledge Cafe is a collaborative effort of more than 10 individuals representing CIS partners and alumni members. And the collaborators represent Asia, Africa, Europe, South America, and North America. And we bring together the expertise and network of researchers and professionals from various disciplines, countries, and expertise to enable cross-learning, sharing, and network building. And this webinar series is one of the components of One Health Knowledge Cafe. And as you saw in the banner of this event, we also have a plan to develop online course on One Health related topic, focusing on outbreak management, outbreak investigations, and we will be holding additional discussion sessions as we develop them. As I said earlier, this is supported by the Center for International Health at Ludwig Maximilian University through DAD Access program and funded by BMZ. As you can see in the map, we have a number of collaborators from different countries, and we have interest to expand this further. So whoever is interested to collaborate with us further, we really welcome. And this is an initiative to kind of establish this network and expand it gradually so that we can utilize this for any future research or any joint project that we might be able to do. So that is the purpose of establishing this one, and we will be connected to the Center for International Health. In today's presentation, we invited colleagues from 4 countries, and we would really like to thank all of them for their interest and availability and putting efforts to prepare the PowerPoint presentation and presenting this today. And the first speaker is from Afghanistan, and I'll introduce the speaker in my next slide. The second presenter is from Bhutan. The third presenter is from Guatemala, and the fourth presenter is from Italy. So as you can see in the map, we have speakers from different continents, and this is the second series of the event. We had another event in last month where we had 4 other countries sharing their experience, and we have another event coming up in September 4th, and we'll have more speakers in that event. And I'll talk about that after the main program as part of the wrap-up and summary. Here, I am presenting brief information about the countries that are represented in today's program and very brief summary of the speakers. And on behalf of the organizing team, organizing group, would like to thank all of them once again. As you can see in this table, these countries not just represent different continents, but also in terms of the health system, in terms of the economy, in terms of literacy. They represent different different parts in the spectrum. As you can see in the table, we have a country with less than 1 million population to a country with more than 60 million. So not just in terms of the population, but also in terms of the human resources for health. So for example, Italy has 4 physicians per 1,000 population, whereas Afghanistan has 0.3 physicians per 1,000 population. So we extracted this data from different sources, and you can see the sources at the bottom. But this is just to highlight that we are talking, and we are not just talking, but we are establishing network of professionals and researchers from different parts of the globe, so that we would be able to learn from each other from different settings. So that's the purpose of events like this. Our first speaker is Dr. Jalhuk Mansoor Arari, who is the program coordinator at Herat Institute of Health Sciences. He graduated in medicine and has a specialty in dermatology. He has worked in different departments such as Institute of Health Sciences, Environmental Health, Communicable Diseases, and Emergency Preparedness and Response. And we are going to hear from Dr. Jalhuk today about the situation and activities, responses, and lessons learned from Bangladesh. Our second speaker is from Bhutan, who is also the collaborator, one of the collaborators for this One Health Knowledge Cafe. So Dr. Karma Tenjing is assistant professor and deputy dean at Faculty of Postgraduate Medicine in Bhutan. He is one of the pioneer medical and health educationalists in Bhutan. And within the short career, he has established himself as a steadfast academician and researcher, and he has been very active and very supportive of the activities that we have been doing through One Health Knowledge Cafe, and is connected with CIS in many other ways. Our third speaker is from Guatemala, Dr. Josh Cortez, and he's an administrator of the SARS-CoV-2 or COVID-19 observatory at Guatemala. He's a physician and surgeon, a gynecologist and obstetrician at University of San Carlos of Guatemala. He's also an epidemiologist at National Institute of Public Health of Mexico. Our last but not least, the speaker is Dr. Francisco Nicoli, who is my classmate in our PhD program at Center for International Health. So we are CIS alumnus. And he holds a master's degree in medicinal chemistry and PhD in medical research. and he has been working in different aspects of international health in last 12 years, focusing in the field of immunology and infectious diseases. So as you can see from the profile of the speakers, we have a wide range of speakers, not just from the geographical location, but also in terms of their expertise and research areas. And we all will be benefited a lot based on what these speakers are going to share today. And once again, thank you all for your interest and willingness to share in this event. Very briefly, objectives of this session are to share current situation of COVID-19, country response, and lessons learned across selected countries, to review and discuss key lessons for the global health community, and to establish a better network to promote learning and collaboration among CIS partners, alumni, and beyond. So with this objective, we are organizing this second event, and we'll be holding another event of more or less similar format. And in addition, we'll have a number of events focusing on other thematic areas, and I'll be sharing those towards the end of the program today. Some housekeeping rules just to make sure that the event goes smoothly. So we'd like to request all of you to keep yourself muted unless you are speaking. So whenever you will be asking question or whenever you will be presenting your side, then you can of course unmute, but otherwise we would like to request you to keep yourself muted so that we can manage the background sound. We'd also like to request you to keep your video off unless you are speaking. And that may help us with the bandwidth, because some of us are living in a situation where the internet connectivity and the bandwidth is not very strong, and would like this to be delivered smoothly, and that might help us with the smooth delivery of the webinar. So that's our second request. I'd like to inform all of you that this session is being recorded, and after the event, we will be sharing this to all people who are interested on this event, or those who might not have joined today. So this will be shared through CIA's website along with the PowerPoint slides that our presenters are sharing today. So this is the declaration that we would like to make. In terms of the format that we are trying to follow today, so we will request 4 speakers to present their presentation, and if there is any question specifically to the presenter and just for clarification question, we will take about 1 or 2 questions for about 2 minutes, and that should be very specific question and question for clarification. But the general discussion, we will be holding that once we have all 4 presenters present their presentation. And sometime because of the connectivity and other thing, there might be some interruption, and we hope that will not happen, but just in case if that happens, then we will wait for a minute or 2, and then we will move to the next presenter. And if the presenter comes back, then we will provide opportunity for that presenter to present. So we will not be waiting very long time, because we really want to finish this webinar within 90 minutes, and we really need to be very smooth in our delivery. Just in terms of the plan, so about 5 minutes, and I am taking about 5 minutes for introduction and the objectives of the session, and then our presenters will be presenting for about 10 minutes. So 4 multiplied by 10 minutes, about 45 minutes, we'll have all the presentations done. And then we'll be spending about 30 minutes to 40 minutes for Q&A and discussions. So with this, I would like to hand over it to Sabina, who will be moderating the session ahead. So over to you, Sabina.
Thank you, Deepak sir. I'm Sabina Sigdel, and I will be moderating the sessions forward. I would like to welcome all the participants to today's webinar. The webinar, as already mentioned, it will be for about 90 minutes. And it's really great that we have an opportunity to hear from 4 country speakers on COVID-19, exchange their experiences, and ensure that the best practices, lesson learned are disseminated and adapted in these challenging situations. So without further delay, we'd like to move to our first presentation. Our first speaker is Dr. Mansur Arari. So we look forward to hearing your presentation, Doctor. Over to you. So you can unmute yourself.
It is unmuted.
Yeah.
Yeah, first of all, I would like to thank all the organizers of the One Health Knowledge Cafe and also all other presenters from Bhutan, Guatemala and Italy, and also all respective participants who are attending from many different countries to this webinar. So I'd like to do you have our presentation?
Yes, we have. So.
Yeah. This is Dr. Ziaul Haq from Afghanistan, and just I want to give you just the first cases of COVID-19, which were the 4 cases from Hubei, China in 29 December 2019, and following those cases, there were positive cases in Iran, the city which was and they were in February 19, 2020. Following that, we had cases in Afghanistan, which were in 24th of February 2020. And if we want to have a comparison among these 3 countries, Afghanistan and 2 neighboring countries, Iran and Pakistan, and also Italy, the total number of cases we have here, total number of cases, and which were in Afghanistan 37,953, in Iran 356,792, and also in Pakistan 292,174, in Italy 258,133. If we want to have just a compare of recovered cases and also deaths, just to show the deaths per million population in compare among these 4 countries. In Afghanistan, we had 35 deaths per 1 million population. In Iran, 244. In Pakistan, 28. And in Italy, it was 586. And the total number of tests which have done among per 1 million population in Afghanistan was 2,578, in Iran 35,784, and in Pakistan 10,903, and in Italy 131,355 cases. And the daily new cases in Afghanistan were the first case was started in our province, Herat, in 24 of February, and then the number of cases increased up to the June. In June, we had the crisis of cases, unfortunately, in Afghanistan, and then the number of cases decreased. And in testing policy, we are right now here in this group, symptoms and key groups. Only those who both have symptoms and also meet a specific criteria like key workers and admitted to the hospital mostly are tested right now in Afghanistan. And we are in this category in the world. And if we want to have a compare among all the number of the cases in Afghanistan and also in our province Herat, we had total number of 37,953 confirmed cases in Afghanistan, and 28,016 were recovered, and total number of deaths were 1,385. And total cases in Herat province was 6,084, and the recovered cases were 5,038, and totally 225 cases unfortunately dead. If we compare among female and male, we among 225 cases who have dead, 28% of them were female, which were 62, and 72% were male. And Herat is in border of Iran, and during that time, a lot of, because of a stigma in Iran, a lot of refugees were returning to the country, and thousands of people were come to the country. Because of this, we just could isolate suspected cases in the border, and a lot of people were coming, and it was a big risk in all over the country. And key interventions which we have done in preparedness level, we had emergency committee at the top level, and deputy vice president was in charge of this committee. And we had emergency preparedness and response committee in public health system and ministry level, and also in all provinces of this country. And also in Herat province, we had provincial center for management of COVID-19, also for coordination among all stakeholders in the province. And also we had budget allocation for COVID-19 in Afghanistan. And in response level, we had detecting the first case in our province, Herat, and after that we had training for health staff on COVID-19, and we allocated a hospital for suspected cases and also confirmed cases, establishing case finding, case contact tracing, case management, disinfection and screening teams, revision the testing protocols, and also call center to have a direct contact with the community. And also quarantine with social distancing and also mobility restriction to prevent the disease, and also avoiding of spreading in the community. And also burying corpses in the caskets with respect to the tradition, because it was also at the beginning difficult to bury the corpses. Fortunately, we could manage them according to the traditions and religious customs. Most of collective religious events and ceremonies were also canceled, and mostly they were praying, for example, at homes, and also during the 8 days and celebrations, they just were sending some congratulatory messages to each other, and so they were sharing some photos through WhatsApp, Telegram, or Facebook. And this was the first hospital which was allocated for the confirmed cases in Herat province, and this one is the second testing lab after capital in Kabul. We could establish in Herat, and also we had health education through mass medias also from TV, radios, and also Facebook, Telegram, and flip charts, banners, and through these things we had a lot of health educations, and we had call center to have direct connection with the community, and border screening mostly with Iran. We had border screening because of huge number of refugees and returnees who were coming back to the country. And lesson learned, information education and communication play a great role to prevent the stigma. Parallel activities should be coordinated among all stakeholders, governmental, non-governmental organizations, community, and religious leaders also. People are really supportive if they are aware of COVID-19. Rumors create problems in the system. Procurement process should be simplified, mostly in emergency situation like COVID-19. Corruption deteriorates the health system. To control COVID-19, poverty is a barrier to implement the quarantine. Transparency among all stakeholders and community, multi-sectoral cooperation is crucial, and commitment also. And consideration, we had lack of clear protocols and guidelines to manage COVID-19 cases. Early detection is really crucial to prevent the spreading of disease. Lack of expertise and equipment. Coordination from central level is a challenge. The situation in PC level is worse. Security is a key factor for a better healthcare services, and global responsibility for COVID-19 to control the disease is really important. And points for question and answer will be these questions, and thanks for having me to the end of my presentation. I think my time is over, and I am here to answer the question if there will be. Thank you very much.
Thank you, Dr. Anhari, for sharing your presentations. Thank you for completing it on time. So if you have any questions for Dr. Anhari, you can just leave it in the chat box. So we will address it at the end of all the presentations. So now we will like to move on to next speaker. He's Dr. Karma Tenjin from Bhutan. We look forward to hearing from you, Dr. Karma. Over to you.
Okay, let me quickly go to it. Can you see my presentation? And Sabina, am I okay?
Yeah,
Okay.
yeah, we can see.
Okay, good morning and good afternoon, good evening, because I guess the participants are from every corner of the globe. And secondly, thank you to the organizers, in particular Dr. Deepak and his team for the opportunity to present a perspective from Bhutan. And my presentation I have taken a little bit differently. I won't be really presenting on numbers, but rather I have chosen with pictures to go with, photos to go with, and to depict the emotions and the experiences we have gone through. So let me start with our COVID-19, the experiences we had and how we have responded as a country, and what are the lessons we have learned through last over 8 months or so with the COVID-19. Bhutan had its the index case on 6th March, and it was not a Bhutanese, but a foreign national who had come here as a tourist, and he unfortunately had developed symptoms, and we had 10 days after the first case in Bhutan, the government directed to have all the Bhutanese who are returning to Bhutan from various countries to be facility-based quarantine, and that's where we started on 16th March. And then the government directed that there is a need to really look at revisit our educational institutions functionally, and they decided that it should be closed on 18th March. it was closed. And then on 23rd March, we had our international borders closed. And then on 11th August this month, we had the first national lockdown of Bhutan. And on just 2 days after the lockdown, we had confirmed community transmission. So I'll be taking my presentation from this point of view, and I'll end with what we have, the latest development as of today. And just to go with, when we had the first case, the index case, who was unfortunately a US national, a 79 years old, a scientist who visited as a tourist, but unfortunately he developed. And that's where the government, our government already had formed the technical advisory group by February. And it was just by luck. Our protocol had just been approved. It was all in line. And then the moment our index case was diagnosed, the public health interventions actually started. We had, the as simple as hand washing measures instituted through all the hospitals, not only hospitals, even wherever there was a big public places, opportunities. So that's where the hand washing places were instituted. And then government also developed an app where you can easily scan with your smartphone, and then you can sort of leave your footmark. It's like a carbon print. So similarly, you can have footprints, or your movement can be traced, and that can easily help us in the contact tracing later on. So this was a sort of a preparedness that we were actually also preparing as a country. And the third one, if you look at the picture down corner here, Bhutan, when we actually, one of the preparedness measure Bhutan was taking was, we were looking at the health human resource, HRH, mapping. And then we found out that country was just over, having just over 3,000 health workers, and our doctors are just around 400 doctors or less in country. So therefore, the high-level committee of the government, which is led by the Honorable Prime Minister himself, so decided that there is a need to train the volunteers. So that's where you can see that we trained nearly 400 volunteers who are non-health professionals. They are from outside the health professionals. So they were given the basic on how to use PPE, the interaction to basic vital measurement, and then how to ensure that in a facility-based patient care, especially the COVID patients. So they around 400 patients, 400 volunteers were trained there. And not only that, all the hospital then also started with their social distancing practices, and then the token system of, and there was a very controlled volume of OPDs, controlled volume of IPDs, controlled volume of surgeries taking place, and then a lot of teleconsultation was happening, which I'm going to touch later on. So these are all sort of a preparedness at the same time, handling the case we had. And then, however said and done, I think it was equally important that we, as a small country, we not only look at our the health proportion, but then how do we survive? We are a landlocked country, so therefore, His Majesty the King himself, he was very concerned. He spent very sleepless nights, many sleepless nights at Ministry of Health. He has an office now at Ministry of Health, actually. So he actually, personally oversees many things himself. And if you look at this picture, is full of, I think, 3 pictures we have taken. He has visited all the various sectors of industries, from farming to cottage industry to small industries to to hydro projects, to see how is the public health interventions actually instituted in these economic, or the economic missionaries of the country, so that we have not an outbreak of COVID-19 from these places, whereby deeply hampering the economic status of the country. And I think Bhutan also went on with, under his leadership, that we went for a mass farming again, thereby sort of a food security, because food security itself is a big issue for Bhutan. And then we had over 5,000 families living across the border. the Bhutan border, southern Bhutan is very porous. We have hundreds of kilometers of stretches between Bhutan and India, very porous. And then, because of the cheap accommodation, the lower economic zone families used to live, or nearly 5,000 families. And if you look at this picture, King himself, from his own fund, from his own finances, he built quite a number of houses within Bhutan. And then Bhutan locked its international border only on March 18th. That was because the houses were completed, and then these 5,000 families actually shifted and migrated to Bhutan. So that's how. And then if you look at this, King is interacting with one of the elderly lady in southern Bhutan, and he was deeply concerned that our health professionals, our government missionaries might not be able to reach the population, unreached population. So that's how he went around, and from the March till now, he has actually traveled the country on foot for 3 times, interacting with the people, asking how they are doing, asking whether they are getting the health services, whether they are getting the essential services, whether they are getting any communication in education on COVID-19. Have any of the health professionals actually come to talk to them? Okay, and then on the measures. And if you look at this down corner picture, these are the volunteers. This orange dress are volunteers. We have this orange dress volunteers. We have 16,000 of them now. We call it Desups. They are we call it in the English version is the Guardian of Peace. And again, this is the initiative of His Majesty himself. His Majesty himself, His Majesty himself has initiated this project, and he went from one post to another, meeting these tens and thousands of volunteers, asking how they are doing, whether they are getting the basic, commodities they are supposed to get to survive, as they guard the porous borders, so that they prevent the people coming from India and coming across. Because for thousands of years, this border has been very porous. They drink water from Bhutan. They drink, firewoods from Bhutan. They are married across. So that way, it's a very porous border. So these are the very high risk zone. So that's why, again, His Majesty has himself, been visiting and seeing. And this is, if you look at one of the command centers or control centers, where they're looking at the security, at the movement of the people across the border. And this is what, as of yesterday, I couldn't get to today's because they could not update. We at this very moment, we have around we have 183. Unfortunately, that was yesterday late night. But today we have around 30 new cases. Unfortunately, not good news, but we have, and then out of this, 118 have been already recovered. They are doing fine. Bhutan has been fortunate so far. We didn't have any of the patients who had expired. Good thing about our country is the leadership is that all the facility-based quarantine has been government funded, 21 days. And initially they started with 14 days, but then His Majesty the King said, no, we should be with 21 days minimum. So, we went into shifted to 21 days. So we have quite a number of them, and we have tested quite a number of, if you look at, I think this is mainly in last 2-3 weeks, it has been quite a drastic. And then one of the preparedness was that we had started all the screening at all the borders, international airports, and many of the public places. If you look at this also, the screening that has happened, if you look at this, right? And one of the initiative was, again, we have flu clinics, almost 59 flu clinics throughout the country. And these flu clinics have filtered quite a number of cases, which was, suspected or later on found to be actually COVID-19. And this is what I was talking, 11th, finally we have reached this lockdown, and Prime Minister himself came on, and then he announced. And after 2 days, if you look at this, the border town of this is the border town Phuntsiling, had our first community transmission. And this was from the mini dry port, where all the imported imported, because Bhutan is an import-driven country. So all our import comes through a mini dry port. And one of the workers there, young boy, they actually got detected with COVID-19. And immediately within hours, there was contact tracing, and 600 people were contact traced within 3 to 4 hours. And our team were from Thimphu, from the headquarters, dispatched, and they were actually looking at, if you look at this, they were really into contact tracing, mass screening. And this is the team who are currently stationed in Punziling, where the community transmission is confirmed. And as of just an hour ago, now we have second town where the community transmission has been confirmed. So now we have 2 towns, and fortunately Thimphu, the capital, is spared. And this is what we have done. And in Thimphu also, they have started testing, mass testing of any suspected, and this is how they can contact, they can look at any. These are all available on the Facebook, ministry website, government website, Prime Minister's office, and then they also have come on television, national radios. And one of the testing centers, I took a picture from one of the testing centers. And these, yes, at the same time, the other health, normal health services has to be continued. So these are the various districts hotlines. These are the contraceptives, and we also similarly have the child protection for women, vulnerable groups, and then we have this hotlines for various services other than COVID, of course, other than COVID. And these are the few pamphlets and information that has been I have taken over just for this presentation, like this one, requesting the public not to delay, because people do often do that. And this is on how to dispose your waste, household waste, and then in depth what are the measures. And these are the smart ways, simple way of keeping yourself away from the COVID-19. And not only that, the government under the leadership of His Majesty the King and the Prime Minister are delivering essentials to the doorsteps. So for instance, I took this from one of the Facebook, so what more can you ask? Medicines are being delivered at your doorstep. So you just have to talk through teleconsultation, and then teleconsultation, doctor writes a prescription, and then the medicines are being delivered. The household essentials are being delivered. Here in this, if you look at the agriculture minister and the finance minister themselves staying overnight and trying to create packages for the people to deliver the vegetables next morning, and by 7 o'clock they were out delivering. And this is again His Majesty the King's initiative, taking care of our elderly citizens again, because these are the group who are really distressed, who can be really left out. So this is for free, and His Majesty's he has this soup again. If you look at this orange dress, these people, they have been distributing essential items from March till now. And then lesson learned, I think I would rather not only go into health, but I have chosen to go as a lesson, as a community, as a society, things we have learned over last 5 to 6 months. Voluntarism and collectivism was one of the key lessons we have taken as a society. As simple as taxi drivers volunteering to take the COVID-19 samples from the collection sites and then dropping to the 3 centers. We have three international level centers which can test up to 2,000 samples in a day. That's the maximum capacity we have. And then these 3 centers combined, we have 6,000 samples that can be tested. And the DESUPs, which is the King's initiative, I said, these DESUPs have been in every nook and corner of our lives, from controlling at the flu clinic to controlling at the crowd, to controlling at the hospitals, to banks, to road, to schools, everywhere. They have been, from guarding the borders. I think they have been very wonderful. In that way, the police, army, and RBGs are really reserved. They really have not been touched. And then, though the free quarantine seemed very economically burdensome, but I think this move has cushioned Bhutan as a country by keeping all the almost 16,000 Bhutanese who came back, and many of them actually were detected positive, but then they were all quarantine based. So till now we didn't have even, till August 11th, we didn't have a community transmission. And young people volunteering at the mini tripod and risking our life, risking their life for us, and kept nearly 6 months safe, because Bhutan imports almost everything from as simple as needle to the vehicles. And then citizens initiative. I think this was one of the wonderful initiative that we feel the citizens have started a motion where they are giving back to the government, giving back to the country. So in last 4 days, this initiative has collected around 10 million, which we are going to probably pump back wherever there is a need, possibly in health requirement, because this in last 2 weeks, government has spent 600 million on mass testing. I think that's a big expenditure for a government. And His Majesty the King himself, taking the front line responsibility, not taking care of his own health, not worried about his health. And the Queen preparing refreshments and distributing to the volunteers. Personally, I think that again shows that we have vision in the leaders. And projects such as feeding the stray dog, because last 2 weeks our stray dogs are foodless, they don't have food. So King has taken the initiative to that the dogs must be fed, because of the lockdown nobody is feeding, we cannot go out. And then King has been giving through his relief fund. Quite a number of families are supported by this relief fund of nearly $175 a month. I think that's a big money for a country like ours, if a family can have that. And these are the picture shots, and the consideration that I thought for my submission for this presentation was that I think as a country we have learned there's an urgent need for a medical school, and because we cannot depend on volunteers, because we rather have medical students rather than the non-health volunteers. That's one thing, because they would be risking themselves and they would be risking the society. So that's why it's better to have a medical school which could be the pool of health human resource in times of like this. And other consideration that I thought was that there needs to be a convenient marriage between political masters and medical fraternity. Fortunately, in Bhutan, this has happened, and we are very lucky that we have 3 doctors in the cabinet. Prime Minister is a surgeon, Foreign Minister is a pediatrician, and we have our own health minister, who is a public health master, public health expert, and our finance minister was a public health program officers before he joined politics. And the last one I thought was from this, again, the learning was there's a serious need to revisit and look at the concept of disease, diagnosis and treatment. And COVID-19 has really given this us, because as a medical professional, we tend to really look at and keep the social and the environmental factors, environmental determinants, social determinants at the bottom of our list. So this COVID-19 has really taught us. That's how I'm trying to say through my presentation. You must have seen that. And I would like to end here with the quotation from Mao King as reflected. I'm not going to read out. And lastly, this is my last slide. Thank you so much. I'm sorry if I've overshot. Thank you, Sabina. Thank you so much. I'll take the questions later on, if any.
Thank you so much, Dr. Karma. So it's very fascinating to see that His Majesty himself has been actively involved in interacting with all the peoples, and the use of volunteers as to obey the people. So we have some questions in the chat box. Maybe Dr. Karma, you can address some of the questions there through the messaging themselves. So
Sure.
yeah, because they are related to your presentation, you can address in the chat box as well.
Sure.
So with this, we'd like to move to our next presenter. He's Dr. Jose. So we look forward to hearing from you, Dr. Jose. Over to you.
Okay, thank you. Good morning, good evening, and good night for all. I'm talking about the situation of Guatemala, COVID-19. And I introduce my country. Guatemala is a part of Latin America and belonging to Central American region, and having its border with the countries of Mexico, El Salvador, Honduras, and Belize. Guatemala have 22 departments and 340 municipalities. Population of Guatemala, demographical Guatemala have more than 16 million inhabitants, spread over 22 from 0 to 14 years, 61 from 15 to 64 years, and age of 65 or more is 5.6%, respectively. The total number of accumulated cases recovered from COVID-19 than 59,000. The cumulative cases is more than 71,000 cases, active cases more than 19,000 cases, case recovered in more than 59,000. Deaths are deaths of the 2,685, and lethality of is of 3.70% in our country. Failure to carry sufficient tests maintains the constant transmission. Transmission of the disease over the time, and not isolating cases in the best way. Quarantine at home is not monitored by the Ministry of Health increase the risk of infection of family members with curfews are weekends having opposite effect than expected. I'll remain the contact healthy relatives longer in our country. The irregularity in pandemic registration is due to the failure to carry sufficient tests, not reaching more than 3,000 tests per day. We have our curve of the epidemic COVID-19 and sustained transmission in the time. We have our first case in March 13, and we have a sustained transmission, and the interventions now have effect on this curve and on this curve of the epidemic curve. The observatory tried to estimate the ideal test for daily testing, and we estimate the number of ideal tests according to the scenarios estimated by the Imperial College of London, varying each scenario, considering Guatemala is an intermediate scenario corresponding to scenario 2, having to perform more than the 80,000 tests daily compared to less than 3,000 tests are currently performed. We have a problem in this case. The observatory raised a question if Guatemala can follow China's model to deal with the pandemic, flatten the curve, and considering that model can be replicated and adapted. The model basically tests states that the municipality should work with central government and Ministry of Health to implement municipal quarantine centers that include the first, second, and third level of care, managed to perform enough tests and all positive cases that not carry good isolation in their homes. This model replicated partially by the government. The observatory serves as repository from consulting clinical, technical, and public health aspects to address the pandemic, with website and Twitter accounts to disseminate information to decision making and for the sector. This is our account of Twitter. We have a tweet message to the government and Ministry of Health in absence of leadership to conduct process as initial guide to addressing the pandemic. In one of the papers presented in the observatory is that this paper is presented at this time that shows the population density can indicator to prioritize the population sectors that are most at risk of disease transmission, rising significantly in those sectors that have more 500 inhabitants per square kilometer. We give many links over publications. These hyperlinks of the observatory page was research editorials done to be interest to the audience we are publishing. This is behavior of the epidemic curves in countries that have better experience than Guatemala. Helen various interventions such as China, South Korea, and Singapore. This is our address of observatory email website that Twitter accounts, and we have the bottom of the beautiful Lake of Atitlan in the department of Sololá. Thank you very much.
Thank you, Dr. Jose, for sharing your country experiences on COVID-19. So it was nice to hear about the observatory that you shared on your slides. So if you have, or to the audiences, if you have any questions for Dr. Jose regarding the COVID-19 situation responses or lesson learned of Guatemala, you can just leave it in the chat box. Dr. Jose will address it either in the chat box or we can address it at the end of all the presentations. So thank you, Dr. Jose. So we have now one more country experience to share. Our next speaker is Dr. Francisco Nicoli. Italy may have an interesting experience with COVID-19. So we look forward to hearing from you. Dr. Francisco, you are welcome.
Thank you, Sabina. Thanks to everyone for logging in. So let me start. I think you are seeing my presentation, right, Sabina?
Yes, I can see.
Okay, great. So thank you for everyone for joining. Thanks especially to my Italian colleague from Ferrara that joined as well. It's a pleasure to see so many people from different parts of the world connected. Some few words about Italy overall. So we have 60 million population, and as you can see from the life expectancy and the fertility rate, we have a very low fertility rate, a very high life expectancy. So basically we are a country where the percentage of elderly people is very high. Our health service is national, but is organized at regional levels, meaning that the care of the health service and the quality of the health service may vary region by region. And it has been supposed that this also affected a little bit the distribution of the pandemic in Italy, because as we will see, it was not homogeneous across all the country. Our health system is free of charge and universal, which doesn't mean that we are not paying at all. There are some visits we are contributing to. Some medicine we are contributing, we are paying a part of it. So it's not that completely everything is for free. Okay, it's important. As probably you have known, at the beginning of 2020, Italy was in many newspapers because it was one among the first Western countries where we had the pandemic spread out. and even today we have a huge number of cases, which was so a total of 35,000 deaths. The majority of them was between March and April, April and May. Which was a little bit peculiar is that we have with trying to explain why we have so many deaths in comparison to the cases. So the fatality rate is very high. We think there are several explanations. One is the timing. As I said, we were probably the first country in Europe to be severely hit, and here you can see the curve of cases in Italy, UK, and United States, and you can see that Italy, the curve started to rise very, very, very early. And so we were not prepared at all. We are not prepared at all. The second thing that we think contributed to this very high number of deaths was the age distribution. So this is the population pyramid of several countries. USA, Brazil, and India are the country with the highest number of cases. You can see that Italy, and then below you have the population distribution of the other country we are speaking of today, so Afghanistan, Guatemala, and Bhutan. You can see that the population pyramid of Italy is very peculiar. Actually is not anymore a pyramid. There are two pyramids, one on the other, and you can see that the majority of the population is middle-aged and old. So we have a very high proportion of elderly individuals. Elderly individuals that I don't want too much to enter in the detail of the immunological processes, but we know that elderly individuals, is the graph in the up, they have a strong loss of immune competence, and in particular, they lose the competence to fight new infection, like emerging infection. So SARS-CoV-2 is something new for everyone, but if someone that has lost the capacity to respond to new infection get it suffers much more from it. And this is probably one of the reasons why the percentage of death was very shifted to the older people. And you can see below the age distribution of death due to different coronavirus, and you can see that in Italy, but everywhere, but especially in Italy, the vast majority of deaths happen in the age group above 70 years old. This is something which is common to several emerging infections, okay? But we notice specifically this for COVID-19. And this is a table that shows where the virus was spreading out, and you can see that in the majority of cases, the virus, the hotspot were the retirement houses, which are in Italy places where the elderly people that they cannot take care of themselves, that they have not the family close by. So old people, they go there, they stay there, they sleep there. There is so they are in close contact. We have many of these retirement homes, and many of them, they were literally a cemetery. They reported in some cases that the 50% of guests died in some of them between May and April in some of these retirement houses. And then, of course, the families, because many of us as the elderly relatives at home, and this was a space where the virus was moving and was spreading from the younger to the older. So the key intervention that we took, so when we start to feel the threat, we start to close some sporting events, to take special precaution on prison, on exams, on tourism, and then there was a very, very quick shift and to much more strict measures. So first we start to close the school in whole countries, and then to close some commercial activity just in most affected regions. But just a few days after, these measures were extended in the whole Italy, even in those regions with very few cases. So only grocery and pharmacies were open. We cannot go out. We cannot go to parks. We couldn't do sport activities. Restaurants were closed. So it was really a strong lockdown period. We could not move between different municipalities, even to go to groceries. So we have to go in the groceries or pharmacies of our municipality. In April, all these measures were decided to be kept until May. So basically, week by week, the government was saying, okay, this measure will be extended until next week, and so on, until and this happened until May, where we experience a gradual reopening of the activities and travels. And below, you can see a summary of the most important measures and the number of, with the graph of the number of cases between end of January to end of June. And so in this way, we were able to go to a very low plateau of more or less 100 cases per day until July. And as you can see in this graph, where Italy is the purple curve, you can see that in the last week we start to have an increase, and we are now at 1,000 cases per day. Why this? Because people, especially in mid-August, started to move on holiday. So I tried here to depict a sort of heat map of people that is going on holiday, and around the middle of August is where the darker red, because it's where the majority of people move and go to beaches or holiday places. There was a gathering of people. Many of them were not taking precaution, and so the infection is a little bit re-increasing. And indeed, if there were already some measures that were suggested from July, after the half of August, new measures were implemented. For instance, masks were now it's compulsory to wear masks even outside. The dancing clubs were closed, and so on. So new measures are in place to try to reflatten the curve and to re-invert it and to decrease the number of cases. So today, with the more of 1,000 cases per day, which are the measures that are in place, we have masks compulsory in closed spaces. In many, in offices, restaurants, museums, religious gatherings, there are special precautions like mask and social distancing. We cannot enter the hospital without testing the temperature and without a proper hand sanification. Tourists coming back from area where there is a high number of cases of COVID have been tested. School will begin soon. There are special rules, and there is still a little bit of confusion on them, but they are in plan to be reopened. And we are increasing the number of tests, meaning that we are testing much more people than before. During the lockdown, the laboratories were overwhelmed, so basically only the people with severe symptoms were tested. Now we are testing many asymptomatic. And indeed, this changed very much the profile of the epidemic. If you can see the map on the left, these are the total number of cases. You can see that they are concentrated in the north of Italy because is where the infection initially spread out, and then thanks to the close of the regions and the ban of movement, we were able more or less to confine the pandemic only in the north of Italy. After the lockdown, we could move again. People went on holidays, as we said, and now you can see that the post-lockdown hotspots are more or less everywhere in Italy, especially on the sea part. What's important to say is that this increase of cases that we are experiencing now is not exponential as it was in February. Okay, it's an increase, but is very slow, and especially, and most of all, that is also very important. We have far less number of deaths because we are more or less the same number of cases we had per day we had in mid-May. Is the graph above, but from the graph below you can see that the number of deaths is far low because we are better organized. So we are in terms of both diagnostic and also better organization of hospital. Another lesson that we learn is that politicians said that maybe it's better not to cut too much on the health system because this may have very bad effect on cases like this. So very last thing, if we are expecting more of these emerging infections, so SARS-CoV-2 today, but new infection in the next years, I think we should take care of especially of the elderly, because we know that the elderly are the most at-risk population for this kind of infection, and those the elderly as population and the places that are usually where the elderly people gather and meet should be specifically addressed in the new pandemic preparedness plans. So thanks to everyone.
Thank you, Dr. Francisco Nigali, for sharing the experiences of Italy. So I guess now we should start with our discussion sessions and the question answers that have been posted in the chat box. I see a few questions in the chat box. We have also some couple of questions that have been prepared in advance. So I'd like to pose first question to all the panelists. I request all the panelists to unmute themselves and we can have a sort of discussions. So the first question is, as Italy have also mentioned that the elderly groups elderly population seems to be a very vulnerable population in this context of COVID-19. So how do we protect the poorest and most vulnerable populations from COVID-19? So I put these questions open to all the panelists. Maybe we can start from Francisco himself, and other panelists can add to his points.
Yeah, so I think the good thing of our health system is that indeed is universal. So so far we didn't notice a real difference of attack rate of COVID between the wealth group, so rich and poor, but of course different is the fact of the age group. So indeed, in our cases, at the beginning, this was not much expected. So this high fatality rate in the elderly, and precautions were not really taken. Now, for instance, these retirement houses, they are very strict regulation. hospitals which are mostly, not only attended by elderly, as well they are very strict regulation. And indeed, so far the new cases are not anymore among the elderly, but are rather in the younger age group. So it seems that something indeed it's happening for protecting this population.
Thanks, Nicoli. So any of the panelists would like to add on to his point? You may go ahead.
Yeah, in Afghanistan also, because high risk for COVID-19 are mostly our elder people. Because of this, mostly elder people stay at homes and they are isolated at home, and mostly the necessities are for them, all the things that they need, other family members provide them, and they don't need to go abroad, and mostly they even at home follow the preventive measures, and also they have also community restriction. Mostly they don't go out a lot.
Thank you, Dr. Anari. So anybody would like to add on this? If not, we can move on to the second questions. Yeah, maybe we can go on to the second questions. Like the question is, what should we learn from COVID to strengthen the health system in our countries? So maybe we can start with Dr. Karma.
Yes, I think, thank you, Sabina. From the Bhutanese perspective, as I mentioned, and the investment on the health sector, though in Bhutan it's the healthcare is completely free, but the investment is just about 2.9 of the GDP. So this COVID-19 experience has showed that we really need to look at the health expenditure, the investment in the health by the government. Like as simple as we really didn't have international standard lab to test COVID till March. We really didn't have. But then after the COVID, we have 3, not just 1, 3. As I often say in many of the presentation I've made, we would have n number of pretexts not to have such lab facility in the country. But now due to COVID, we have 3. So I think if there is a really there is a sort of will, I think there is a way. The second thing that I again presented also in my presentation was that I think we really need, Bhutan as a country at least, we really need to look at investing on the health human resource. I think we are really in short, and I'm sure it is no different even in a big country as developed country as Italy. I think they have really struggled with the health human resource, and Bhutan we just have 3,000. So I feel that both the political masters and the medical fraternity have to really sit down and revisit and relook at our strategies in health financing and investment in health human resource. Thank you.
Thank you, Dr. Karma. Maybe Dr. Jose also would like to add something on it about Guatemala, how Guatemala has been doing to strengthen the health system, or what could be done in future to strengthen the health system.
Yes, well, it's difficult for Guatemala. It's difficult to cover all population because we have 3 providers of health: public health, private health, and ONGs. And this is difficult to give a follow-up of COVID-19 patients on their house. And the Ministry of Health have no more money resource for these activities. I'm considering it's difficult to should maintain balance between economic measures and health considerations as countries must provide resilience to have options to economic reopening without putting population at risk. The balance is achieved by having social programs targeted vulnerable population in poverty and extreme poverty, so as to have better food security.
Okay, thank you, Joe. So maybe any of the speakers would like to add on these questions?
Yeah, in Afghanistan also, in my opinion, in these situations, we have to focus more on coordination and also equal health services, because we had to mostly focus in the cities, and unfortunately, we couldn't provide many different facilities in the remote areas for the mostly vulnerable population. This could be a lesson learned for the future, to focus also on the remote areas. And also another thing which was very important for us, in my opinion, local decision in future must be done in during the emergency conditions, because sometimes maybe centralized system creates some difficulties in local system.
Thank you, Dr. Anadi. So maybe we can move on to a slightly different issues. So we have heard that, we know that COVID-19 has an impact, direct impact on the economic sector. So how do we balance the economic and health consideration during the COVID-19 situations? Any viewpoints from the speakers? Maybe we could start with Francisco.
Yeah, of course, it's a very difficult issue that it's differently addressed by different countries. For sure, the effect of an economic is devastating, but the effect of economic has a reflection then also on the future health services, because no work means no taxes. No taxes means no future health services for other kind of for every kind of health problem. So we cannot think of stop the country forever until the epidemic is finished. The fact that we are isolating cases and we are closing. We are making red zones around those cases, those hotspots, and not the whole country. I think it's important because it allows the rest of the country to proceed and go on. And we hope we can continue like that, because I'm not sure we will be able to bear a second national lockdown from the economical point of view. And this is also important. This is also what people should start to think. I mean, many now are minimizing because the number of deaths is not so important as 5 months ago, and so I think the risk is gone. No, the risk is not gone. We should continue to have a certain level of attention, and it's also to prevent a second lockdown. Then a threshold when the lockdown should be implemented or not is difficult, is very difficult to say.
Yeah, thank you, Nicole. So any other speaker would like to add on this from their country experiences, from their experiences?
Maybe I'll add something here. From the Bhutanese perspective, we are a very small economy, and we don't have big industries. We really don't have sort of investment-driven economy. Ours is more of a capital, dependent economy. So from that perspective, yes, whether we really open up on full-scale economy or not will not be much of an impact. So that's why we, as a country, we have chosen to really look at and take care of our citizens first, and then we will really look at prioritizing how can we reopen, but reopen only the vital economic activities. Now, other than that, like we have tourism is one of the big industries, economy generating sector, but it has been closed for 6 months. And we look at our income generation, and it has not deviated much from what we were actually having in our exchequers. So therefore, from the Bhutanese perspective, I think we really need to look at balancing, do some balancing act on the health versus the economy. And that's why in Bhutan we have chosen to look at preserving the health of population, because economy can always be recovered, because we are a small economy, not developed first world country like US or even as big as Italy. So that way, we are okay, we are happy. Yes, maybe, but we cannot go on and on. But maybe even if it is going up to 12 months, then we might really have to look at, can we really actually look at, for now, last 6 months, our economy is doing fine. Thank you.
Okay, thank you, Dr. Karma. So we have got some questions from the audiences also. So any of the speakers can address it. The question is, how important is it considered to test for antibodies IgG and IgM to monitor the disease in your country? So maybe one of us could answer these questions. I guess it's a bit immunological, I don't know.
Yes, for Guatemala, it's important this test, and we have zero prevalence of immunity of the overpopulation and the spread of the infections. That's an important point for our country.
Okay, so anyone would like to add on this? How important is considered? So I don't know whether there are different antibodies, whether IG and IgM. So maybe.
Yeah, so the IgG, usually they are, both of them are antibodies. When you have IgM, it means that you are probably something ongoing. If you have no IgM but only IgG, it means that you had the infection before, but the infection is not ongoing. The serological test compared to the PCR test are more rapid, and so here in Italy they are used, for instance, now to screen the teachers before going to school. So just with a drop of blood they can test, and if they have IgM, okay, they then do the PCR test to see if the infection is ongoing, and in this case teacher will not be admitted to school. Conversely, if they don't have IgM but they have IgG, it means that they had the infection before, but now they are no more infected. So yes, it's something used, and it's important.
Okay, thank you, Francisco. So we have got another common questions from the audience. They want to know about the contact tracing. Maybe Dr. Karma has already given an answer regarding from the Bhutan. So they would like to know, what is the impact of contact tracing as a suppression policy for COVID-19 in your country? Maybe we could start with Afghanistan.
Yeah, we have contact tracing system also here. Mostly it was really good because in contact tracing we could follow mostly the persons who were in direct contact with the confirmed cases. And fortunately, in following of them, and also after finding the first signs or other symptoms related to COVID-19 with the people who had the direct contact with the cases, with the confirmed cases. So we had also, beside the contact tracing, also management also for the diseases team who were directly helping the patients who had signs and symptoms. Fortunately, in contact tracing, when we had some confirmed cases and they were mild, they could stay at home, and also they could follow the consultation of the our specialties with direct contact with them they had, and they were following the cases even if we had some severe cases at homes. We could transfer them by ambulances to the hospitals. So in contact tracing, fortunately, we could control and also advise and consult with all the patients who were at home because of low capacity at the hospital in Afghanistan. We had a lot of cases who were isolated at homes. So with contact tracing teams, fortunately, we could cover most of the cases who were at home, and also the people who were relating to them or in direct contact with the patients at homes. We could control them, and the positive cases, mostly a large number of them were isolated at home, and also the people who were new cases, all member of the family who were new cases who had contact with the positive cases were directly, maybe in mild cases, they could stay also at home, but the severe cases were transferred to the hospital.
Thank you, Dr. Anali. So maybe we can have a last question for this Q&A session. The question is that what is the role of networks of international experts in combating the COVID-19? Maybe this will be the last question for this webinar. So anyone can start. Maybe we could
I'll yeah, if since nobody's answering, I thought I'll just start.
Yeah.
For when we had so just to give an example, when we had the first first COVID index case on 6th March, our health professionals were lost. We didn't know what could be the most correct treatment, how to go about, right? So therefore, Bhutan health system has a lot of linkage with Singapore, So we had our Singapore experts, coming in, and they were the ones who really helped us, pull through. And we also have had one or two experts coming from India teams, All India Institute of Medical Sciences, and even those experts came in, and they were actually airlifted, and they were here. They almost for 1 month or so, they really looked at, helped us, and that way now, the management of the clinical management has really improved all over because of the very experience. Now thousands of publications are happening, but in March, when we had the first COVID case in Bhutan, a US citizen, I think Bhutan, especially the health professional, the doctors really had tough time, because we have just one ICU specialist, we have just 2 emergency physicians, and we have 5 medical specialists in the country. So they literally struggled. So this is what we would like to share. Thank you.
Anyone would like to add on this? Okay, so I see lots of questions regarding the vaccines and all those things. Yeah, I see all the questions. There are many questions regarding the vaccines and all those things. So most of the question, it has been responded by Dr. Joyce in the chat box. So it might be interesting to know that we have the webinar related to vaccines and immunology to be organized in September 30. So I'd like to request all the attendees to attend that webinar, and we will share the registration link soon. So maybe this might be the. So with this, I'd like to thank all the speakers for their insightful presentations and the wonderful discussion. Thanks to Dr. Anhari, Dr. Jose, Dr. Francisco Nicoli, and Dr. Karma Tenjin. Thank you for your time and effort you took in sharing your presentations. I also would like to thank the participants for your time in attending the webinar. So we really had a wonderful discussions, and hope you all enjoyed the presentations. So thank you, everyone. So I'd like to hand over the sessions to Deepak sir for further informations and further closing remarks. Thank you.
Thank you, Savita.
Thank you very much.
Sabina. Yeah, wonderful moderation. And on behalf of the organizing team, I would like to thank all 4 speakers for their preparation and for the delivery for the session. Very exciting to learn how countries are coping with the situation. Situation is definitely challenging, but I think we can learn from each other. We can support each other to combat this virus and the situation that we all are facing. And it is really good to know from each other what are the things that have been done in other countries, so that will kind of inspire us to do better, to do more in our setting. And I would also like to announce the upcoming webinars that we are planning. So on September 4th, as we discussed earlier, we'll have another session, the kind of third session on this series, where we are going to invite speakers from Brazil, India, Nicaragua, and Tanzania. Again, 4 different countries, and very interesting stories to hear from them. On September 30, we have a session on vaccines, and we seems like there is great interest on this one, and we really would like to learn more about what has been there, what is promising, what are the hopes, what are the issues and consideration for all of us. So that's the session coming up. And then from October, November, December, we have some sessions planned. We haven't fixed the date and speakers yet, but those are the events that we'll be planning and organizing. So one will be focusing on health equity, another will be focusing on diagnosis and treatment, and the third one would be focusing on health system. We are also considering other potential topics, because we can add additional topics in this upcoming months. So one that is under consideration is travel and COVID-19. So these are the topics under consideration. The schedule may change based on the availability of speakers and interest and other things. So this is just the announcement. So please keep following the CIH website for some of these webinars. And we will also be sending out invitations and information about upcoming events through the email that we have for this One Health Knowledge Cafe. So I'd like to thank all of you for attending today's program. It really went smoothly. Thank you for your active participation. Some of you have been asking us for the PowerPoint slides and webinar recording. And as I said earlier, that will be available within few days in CIUH website. So please check in that website to download the PowerPoint and the webinar recording. And if you have any inquiries or suggestions for organizing events or to make them more effective, more organized, please feel free to contact any one of us or to our common email, which is onehealthknowledgecafe@gmail.com. So with this one, I'd like to thank all of you, all speakers, and all attendees to attend today's program. And thank you, Sabina, for moderating. So thank you, all of you. Have a great day. Good night, and bye-bye.
Bye. Thank you very much.
Thank you.
Bye. Thank you.
Hello.
Thank you, Dr. Bach.